Hi, everyone. So I know that we are still in the thick of COVID-19, and a lot of us are wondering, what is going on? What is real in the media? What is not? How severe is this virus? Why are we seeing so many people being affected? Why are we seeing the numbers rise? And, what can we be doing to be proactive in order to obviously prevent dealing with the virus, in addition to making sure that our families are well protected? So I wanted to just expand a little bit upon the original information that I provided about a week ago. But first and foremost, I want to send a message to our current patients as well as the patients that have worked with us even in the past year. Is I want to just remind all of you that you are very well protected in the sense that you have done some really, really immense groundwork on your system in order to clean up your detox pathways, to get foreign pathogens and toxins out of the body, which really has taken a huge burden off of the immune system. So your immune system is definitely working a lot more optimally than other people. And this is just something that I really want to expand upon, because what people are not necessarily understanding is that this is not necessarily about the virulence of this virus, meaning how aggressive or strong this virus is. It actually is tying into how well can your body handle it. And I want to just bring up a quote from a very good friend of mine, Dr. Brett Jones, who we actually went to school together. And I saw his post recently today, and it was COVID-19 case fatality rates have more to do with the sickness of the host than the strength of the virus. So I'll say that again. COVID-19 case fatality rates have more to do with the sickness of the host than the strength of the virus. And when I read this, I was like, this couldn't hit home more, because it's not that this virus is any stronger than the Epstein-Barr virus that causes mono, or the herpes simplex virus, or the flu virus, or other viruses that infect the respiratory system. But what we're not realizing is that the virus is preying on the weak immune systems. And this should be very eye-opening to the general population, because most of us are walking around with symptoms that are our normal. And if you've listened to any of my webinars, you will hear me say this on repeat, because most of us are dealing with symptoms that we just classify as our normal. And what further validates that is when we go and get our physical or our blood work annually, it says, yep, you look good, everything looks fine, but you have exercise-induced asthma, or you can't take a full deep breath, or you get random chest pain, or you have random irritable bowel syndrome, it comes and it goes, or you poop once a week, or you have migraines. So we have just classified these things as just being normal. Oh, it's genetics. Oh, it runs in the family. But in reality, every symptom that we experience is a sign that there is dysfunction, and it's our body's way of saying, hey, there's something wrong, help. And we live in a model that symptoms are either disregarded, or if they get severe enough, then there's going to be a pill to cover up that symptom. So when we are talking about this virus and who it's preying on, it is preying on people that already have pre-existing conditions, if they know it or they don't. When people come through my doors, they usually come through my doors because they have a specific issue. And some people are obviously more severe than others. Some people have a whole array of symptoms. Some of them are like, listen, I really just need to get rid of my migraines, or I really need to deal with my Crohn's disease, or I really need to deal with my heart arrhythmia or my heart palpitations. But as we start to dig deeper and we ask better questions and we do better testing, we realize that there are a myriad of different things that are going on that are causing mild symptoms, but also cause them to be a ticking time bomb for bigger problems down the line. So the good thing is that we're able to negate that by removing those stressors and getting the body to an optimal place. But when we're dealing with this virus and now it's affecting all different age groups, it's because sickness and chronic illness is not biased to an age group. This is not just the elderly are immune compromised. Our children are immune compromised. Most of the children that I work with are toxic with heavy metals. They have a compromised immune system. They have neurological stress. They have viruses in their brain. Guys, there is an epidemic of autism, Asperger's, learning disabilities, ADD. It's all around us. And we, again, are being told that these things are, well, it's just normal. It happens. It'll eventually go away. If it doesn't, here's a pill. So I really just want to drive home that this should be such an awakening that our system is broken. And we need to start thinking bigger, and we need to get out of the mindset that you fix it when it's broke, because a lot of it is already broke, but it's just not bad enough for you to take action just yet. Or it's not bad enough that your blood work looks bad enough for your doctor to say, ooh, maybe you should see a specialist. And even when you go see the specialist, no one is piecing the puzzle together. Nobody is saying that your heart palpitations might be actually caused by a neurological issue, or your depression might be caused because you have irritable bowel syndrome, Crohn's disease, or ulcerative colitis. These are all connected. We need to start understanding that the body is not just a bunch of separate systems that work independently from each other. Did you know that your respiratory system and your kidneys work hand in hand? And that one of the biggest driving forces why people have kidney issues is because of bad blood sugar issues. So I'm not talking diabetic people, I'm talking about the hypoglycemic. So let me just explain to you what hypoglycemia looks like, because this was me. This is most of the patients that I talk to. You wake up in the morning, you're not really hungry. Some of you are like, oh, I can't even think about food in the morning. It actually makes me nauseous to even think about eating. You have a cup of coffee, maybe 2, maybe 3. Now you've suppressed your appetite. Now you get to lunchtime and you're starving. But by the way, it's intermittent fasting now. So now it's good for you to skip breakfast and not eat until 12 o'clock, 1 o'clock, 2 o'clock. Now you're starving. Automatically, your body intuitively wants carbs because it wants to raise your blood sugar because it's so low at this point. You grab a sandwich, you grab a sushi roll with a bunch of rice in it. Maybe you grab a wrap, maybe you grab a salad, but you want that breaded chicken on top. Listen, I've been there. So now you eat, now you crash because your blood sugar just went up. Now it plummeted. Now you want your midday pick-me-up. Some of you go for caffeine. Some of you go for candy, vending machine, chocolate, sugar. So now dinner rolls around, you're so hungry again that you're snacking on your cheese and crackers and different things as you're making dinner, before dinner is ready. You get done with dinner and now you want a snack. Now you want your sweet treat, or you want your carb treat, you want popcorn. Listen, this is so many of you. And this is a sign that you have bad blood sugar. Bad blood sugar, it creates more stress on the kidneys and the lungs directly correlate with each other. So if you are dealing with kidney issues, maybe you're chronic urinary tract infections, maybe bad blood sugar, maybe you have a boatload of metal fillings in your teeth, maybe you just eat a ton of fish and maybe you have mercury exposure from that. There's a million possibilities. So now your respiratory system is actually more vulnerable because of the connection between how much your lungs and your kidneys work together. So from here, now we also have to think about all of you that don't sweat, that you don't sweat, or maybe you've had chronic strep issues. So when we talk about strep getting in the tonsils, maybe you've had your tonsils removed, maybe you don't get the strep now, but you get those like low-grade sore throats or your postnasal drip. So all of that infects these lymph nodes, and guess what? They go all the way down into your armpit, and that is the lymph that works directly with your respiratory system. So guess what happens? Most of you get these swollen glands. You kind of think, oh, it's just neck pain, or you just don't sweat. You go to the gym and you glisten. These are all signs that your lymphatic system is not working. Your lymphatic system is a huge component of your immune system that helps with fighting off viruses. It also works very much in conjunction with getting bad stuff out of the respiratory system. So these are all things that are pretty much red flags saying, hey, you might be more susceptible to having negative effects from COVID-19. So the point is that I'm going to give you a bunch of really fantastic things that you can be doing. But when this is all said and done, is you need to think bigger. You need to think about your health as a whole, because if you are that person that is so fearful of this virus, there's probably a reason you are fearful of this virus. You are fearful because you know that you haven't been taking care of yourself. You know that your body is not in good shape. You know that you're inflamed. You know that your gut doesn't feel good. You know that your immune system's not working well. And you know that your lifestyle is incongruent with health. And listen, this is no blame. We've all been there. We're busy. We're trying to navigate careers. We're taking care of families, kids. What do? We put ourselves on the back burner. I get it. I've been there. I still go there sometimes. But I always say, if you fall off, get back on. That's the best that we can do. We're not going to be perfect. And this is also not about living in a bubble. You know, people are asking, what are you doing? Are you wearing a mask? Are you wearing gloves? What are you doing? And I'm like, I've been proactive for my health for 10 years. I don't fear this. And I'm not being ignorant. Listen, I know that some of you are like looking at the data and going, no, this is a serious virus. It's drowning people. Yeah, it is. 100% it is. But it's not going to do that to my body, because I know where my body is at. I test myself every few weeks. I am doing every known alternative immune boosting therapy. I take supplements regularly. I exercise. I am good. I feel confident in that. And I don't operate out of fear. I operate out of data and good information. And I want you guys to know that, yes, this is not to not be taken seriously. And especially for you that are immune compromised, already have pre-existing respiratory conditions. But you might be thinking, well, I need to bring out the big guns. I need to, do something in the pharmacology world or medication world. That's the only thing that's going to protect me. And that couldn't be farther from true. There is tons of data just on vitamin C and how that is one of the most effective therapies for once you have the virus, as well as being preventative. They're also showcasing data on propolis in an inhalation form. There is another modality called HOCl by a company called Briotech. So one of the things that you're going to see as a link in this post is that you can get access to this teeny little mister that you put your HOCl or your propolis. Unfortunately, propolis is completely sold out from anywhere that I've looked right now. But the HOCl is something that we actually have in stock. You add that into this mister, you turn it on, and it will put in HOCl vapor that you can breathe in that will actually get into your respiratory system. This is something that as you do it, you actually feel your airways opening up. So this is something, it will cost you $40 to get both of these. There are different things in the supplement family in the realm of licorice root, andrographis, Japanese knotweed, rosemary even. So please take a look at all of the data that I have listed here so that you can see what can be beneficial for you to be both preventative, as well as, even if you are feeling symptomatic, different things that you can do to also help your body recover. Listen, I know that a lot of this stuff is sold out right now. It's even sold out and hard for me to find as a practitioner. But because I have special accounts with certain companies that only distribute to practitioners, I am stocking up on tons of things at Integrative Wellness Group, things that can be shipped directly to your door, as well as that can be picked up. So if you are looking for alternatives, you have two options here. You can just browse through this post and then shoot us an email and let us know what you want us to ship you. If you want to get really, really specific, because maybe you already don't feel well, is you can actually hop on with one of our practitioners in order to actually figure out what is best for you by sending us a hair sample, which contains your DNA, and we can use the DNA of your hair to actually figure out what immune boosting supplements can be best for your body so that you are the most protected, as well as helping your body to recover even if you are not feeling well. So there are tons of options, and there are ways that we can get extremely specific and personalized so that you are not just sitting back fearful of this virus and thinking, when is it going to take me down? So this is, again, there are things that we could be taking orally. There are things that we can be using in our homes from a vapor standpoint. And again, if you need help finding these things, please use us as your guide, because not all supplements are created equal. I know that we all want to get things that are, in the lower cost bracket, but unfortunately, lower cost when it comes to supplements doesn't always equate to quality. So you really want to make sure that you are not wasting money on things that are not good for you, as well as things that are poor quality. One of the other big things that I talked a little bit about on my last post was melatonin. Some of you take melatonin to help you sleep. What a lot of you don't realize is if you take melatonin to try to sleep and you have weird dreams, that is because melatonin also has a massive detoxification effect. Melatonin is one of the most potent antioxidants of the body. So I really don't recommend doing high dose melatonin if you are not under the supervision of a practitioner, but this is another alternative that is a bit more readily available in order to combat this virus as well as be preventative. Of course, you're not really using melatonin early in the day because you don't want to compromise your cortisol levels. Number two is it will make you sleepy. But again, not all melatonin is created equal. One of the best ways to use melatonin is actually topically. So using it transdermal in the form of a lotion. So if you are running out of options, you're not able to get access to vitamin C and other herbs, you also do have a lot of sleep issues, melatonin might be a really good alternative for you. But if you are seeking out the use of melatonin, again, I highly, highly recommend taking advantage of our DNA pack so that you can have direction by our team to use it properly, because it can create a pretty significant detox reaction. So secondarily to that, if you are someone who suspects you have the virus, or you are just feeling that you're getting a lot of muscle twitches, you're getting a lot of muscle cramping, one of the things that this virus does is it really alters your potassium levels. So this can create a lot of issues with muscles, cramping, twitching, etc. There are some really fantastic products that are out there. My personal favorite is Physician Standard, which is a combination of quercetin as well as potassium, which is not only really helpful for your blood sugar, kidneys, but it is also helping to replenish what you could be missing due to exposure to the virus. And it also, the quercetin has a lot of immune boosting benefits that can really help to combat the virus at this time. In addition to that, for those of you that are wanting to take it a step further, one of the best things is heat. So in the form of an infrared sauna, particularly, COVID is heat sensitive. So by raising your body temperature, you will actually have a lot of benefit in helping your body to burn off and eradicate the virus. So infrared sauna is something that we are offering at Integrative Wellness Group. We are not allowing more than one person at a time in the sauna. So this is an alternative if you are local to us. You can also just take hot baths. Epsom salt baths can be beneficial. It won't necessarily raise your temperature as high as the infrared, but this is something that could be of benefit to you that are looking to do more. So overall, if you take a look at all of the data that I have listed in this post, you're going to be able to have a lot of really good options according to your needs. So we have different options that can be really beneficial for boosting up the immune system through supplementation. There are some other options that are really beneficial on supporting the liver through this process, because this virus is cleared through the liver. So if you have pain on your right side, or you've had gallbladder issues in the past, please make sure that you're taking a look at some of the products that are recommended to be supportive to the liver, because this will work in correlation with the immune boosting support that you're also using. Again, if you are looking for things to specifically support the respiratory system, Propolis is one of the best options. HOCl is a secondary option used either through a humidifier, which I do have a link for, or if you're looking for something that you can actually throw into your purse and bring with you, there are these mini facial misters. We actually sold out last week, but we have a stock coming in about 2 days, which would bring us to, I guess, about April 8th. So again, let us be your guide and give you the support that you need through this process. But I hope that this was helpful in the sense of thinking bigger beyond this virus, because this is not just about the strength of this virus. This is about the vulnerability of our population because of the toxins in our food, the toxins in our water, the chemicals that we are exposed to day to day from the personal products we use, the water contamination of our oceans that we swim in. This is the stress, the lack of sleep, the fact that we're burning the candle at both ends and not giving our bodies a rest. We are dealing with high stress environments. We are constantly connected through, technology. We never get a break mentally, emotionally. Guys, every single one of these things matter. Just because you can handle stress doesn't mean your body understands that on a cellular level. So it's time to take a step back and to really rethink what health looks like, because it doesn't look like this. It looks better. It looks personalized. It looks like your doctor spending time with you. It looks like your doctor asking better questions, giving you alternatives outside of a pill or a surgery. It looks like better nutrition. It looks like a more balanced lifestyle. It looks like being able to sleep, being able to wake up happy, being able to not live in a constant state of anxiety. Guys, this is something that you can attain. You just haven't had the tools yet. So I hope this was helpful. I hope this brings you peace of mind. And I hope that you know that we are here every step of the way to keep you guys in the loop, give you good information, give you solutions, and to really help you to get your health back on track. So if you have questions, please let us know. But we are here. We are helping people. We are open. We are doing a lot of things virtually. So no matter where you are, definitely use IWG as your guide. All right, guys, I will see you soon. And please stay safe during this time. Let go of the fear and just know that there's so much that you can do to be proactive.